Did you know that chronic post-concussion headaches can be alleviated with no drugs and non-invasive treatment? That's right. The missing link in conventional medicine's treatment approach is evaluation and treatment of distortions of the cranial bone motion and structural instability of the entire body. When the skull is traumatized, cranial motion gets distorted and causes a torquing or twisting of the dural membrane system from the brain down to the coccyx bone. This extended attachment is the reason for many of the chronic post-concussion symptoms. Unfortunately, the subtle motion is never evaluated during routine examination. Case in point, on November 20th, 2025, I examined a patient from Canada. He gave a history of 2 concussions several years apart. Numerous treatments never resolved the patient's lower back, neck, and chronic headache pain. Chiropractic, osteopathic, physical therapy, and medications all focused on symptomatic relief. The patient presented multifactorial issues that no one practitioner pieced together. Peter had cranial distortions, pronated feet, which destabilized his upper second cervical vertebrae, and a subluxation of his pubic symphysis. He also had an underactive thyroid and sympathetic dominance. Successful treatment required that all the factors be addressed simultaneously to stabilize the entire body. Within the 3-hour appointment, all the structural distortions were corrected. In addition, Qigong acupuncture was used to reset the brain circuitry and calm down his sympathetic nervous system. A cyberscan evaluation picked up parasites, which contributed to his overall toxicity. At the end of the 3-hour appointment, Peter stood taller, had no lower back, neck, or headache pain. The takeaway message is that complex problems require an in-depth knowledge of functional anatomy plus interdisciplinary skills to rebalance the entire body. Unfortunately, there are very few practitioners worldwide that have these combined skills. For this reason, many post-concussion pain patients linger. For more information regarding post-concussions, go to www.concussionreversed.com.